Hello, and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife practicing in Santa Fe, New Mexico. I specialize in family practice, bioidentical hormone replacement therapy for men and women, as well as women's health and aesthetics. I'd like to welcome you to the podcast today. Today I'd like to continue a little bit from where I left off last week, where I was discussing hormone replacement therapy for women, and I would like to get into talking about testosterone replacement therapy for men. I'm going to talk about all of the different types of hormone replacement therapy, but the focus will be on bioidentical hormone replacement therapy, which I believe is the safest, the most effective, and what we do primarily here in the office. So as a opening, we all hear about on TV all the time male menopause or andropause. It's everywhere. It's on commercials. It's discussed on talk shows all the time. And this male menopause or andropause, as it's been coined, especially by the media, is a little bit misleading because it really suggests that men have a sudden drop in their testosterone level in middle age as compared to women who are going through menopause. And this, frankly, isn't really true. For most men, that is. So most of the time, men will go through a gradual change in their symptoms and in their testosterone level because unlike women, they usually don't just stop producing testosterone suddenly unless there is something pathological that's occurring or they've had some sort of procedure done or something has occurred that causes them to just stop producing testosterone. But most of the time, it's a gradual decrease in testosterone production. So we know that as all people age, around the age of 35, we start to slowly have a decline in our hormone levels. And this is true for men. They'll start to have a slight decrease in their testosterone over time without really notable symptoms most of the time until around the age of 45. Then they will start to have a little bit more increase in that loss of testosterone and may start to develop symptoms at that time. So symptoms, and oftentimes men don't even have symptoms at 45. Sometimes men have symptoms at 55, 65, 75, and some men have told me they've never experienced many symptoms, but a lot of men do. And so this is kind of geared to give you information on what decreased testosterone level is, what the symptoms are, the workup, the treatment options, and then for people to decide on their own, is that something they want to look further into. So some of the symptoms that we see as men start to naturally lose their testosterone would be having a slight increase in sweating at night. So a little bit of night sweats, excessive sweating, sometimes sleeping problems, so difficulty falling asleep, staying asleep, or both. They'll have sometimes an increased need to have sleep during the day, like they want to take a nap mid-afternoon. Sometimes depressive mood will occur where they're just not feeling as well. They feel a little bit down, a little bit sad. They might have a little bit increase in irritability. And so this might include, mood swings or feeling aggressive or angers easily. And a lot of times people associate with high testosterone levels with the anger and aggression, but men can experience anger and aggression with low testosterone as well. And then having increase in anxiety where they're feeling kind of an inner restlessness or feeling panicked or feeling nervous. Those are also associated with low testosterone levels. Physical exhaustion is really commonly experienced in men who are having some drop in their testosterone level. So decrease in muscle strength or ability to build muscle mass, decrease in endurance, increase in fatigue, lack of energy, decrease in stamina or motivation. Those are often signs that a man's testosterone levels are dropping. And then again, sexual problems. So change in sexual desire or in sexual performance, decrease in the libido, difficulty in sustaining an erection or ejaculating are often signs of low testosterone, and sometimes waking up without an erection. Bladder problems are also common with low testosterone, so increase in frequency to urinate, difficulty in urination, also joint and muscular problems, so joint swelling, joint pain, muscle weakness, decrease in recovery time after exercise. People also, men and women, can experience increase in memory fog or difficulty in finding words that they want to say when the testosterone starts to decrease, and difficulty in learning new things and having memory retention. Sometimes increase in headaches, so intention headaches, migraine headaches, that can be seen with low testosterone. And then for men as well as women at times, but more frequently seen in men, is rapid hair loss or thinning of the hair. Sometimes men will feel cold frequently, especially their hands and their feet. And then having increase in weight gain or difficulty losing weight despite increased exercise and following dietary regimens that should help with losing weight. So those are often things that we see with low testosterone. Now these symptoms are not just associated with low testosterone. So there are other physical pathologies that can cause these symptoms as well, which is why it's really important for anyone, whether male or female, to have a full, thorough evaluation before beginning any type of testosterone or hormone replacement therapy. So in order to get a workup, it's really important that you see somebody who is well versed in hormone replacement. Not just synthetic hormone replacement, but bioidentical hormone replacement, because you want to go to somebody who can give you treatment options and just not offer a one-size-fits-all approach to treating a health concern, specifically with hormone replacement therapy. So when you go in to see your provider, you want to make sure that you've done your homework and that you're seeing somebody who knows about the workup for hormone replacement therapy, how to interpret the lab results, and then how to offer a variety of treatment options. So when we see somebody here in clinic for complaints of possible low testosterone, we do a complete evaluation. What allergies does that patient have? What long-term health problems does the patient have? What medications are they on? What's the family history, social history as far as smoking or tobacco use, alcohol consumption, even caffeine consumption? We get a thorough past medical history on that patient themselves. What surgeries have they had? What types of illnesses as a child have they had? Are there different possible causes for their low testosterone or their symptoms besides just the fact that they're getting a little bit older? So we know that men and women are designed to live to be about 45. And when we don't live past 45, then hormone replacement therapy and having adequate hormone levels and being hormonally balanced is not a factor. But we're living well past 45, most of us, into our 70s, into our 80s, even into our hundreds. And our quality of life is not sustainable to what it is when we're in our 20s, 30s, and 40s. And we're finding that a lot of that is due to having low hormone levels, specifically low testosterone for men and women. I mean, obviously estradiol and progesterone are important for women, but low testosterone is a huge key into a lot of our quality of life and the decline in that. So when I see somebody for potential hormone replacement, I also ask them, have they done hormone replacement therapy in the past? Have they done anabolic steroids in the past? What have they put in their system in the past to possibly give them some enhancement? And it's very important that they're honest with me so I know how to proceed with their workup and possible treatment. So once I've determined that a male is appropriate for possible hormone replacement therapy, then the next step is really just a simple blood work. We will check a person's or a male's estradiol level, their testosterone level, their complete metabolic panel, which gives us a look at their proteins, their liver, their kidneys, their blood sugar, their electrolytes. And we do want to do a complete blood count. I always get a complete blood count to look at the white blood cells, make sure that there's nothing going on more significant than we need to be looking for, to make sure that everything looks appropriate with the hemoglobin. And then also I do a prostate-specific antigen to make sure that there is no increase in that level suggestive of prostate cancer. And then also we're going to do a check of the thyroid, because the thyroid levels are also important in balancing out somebody's hormones and can cause a lot of the symptoms that we just talked about. And then also doing a complete and full physical exam. So men really do need to be cleared before starting testosterone therapy. They need to have the prostate checked. They need to have a urological workup done. Now, it doesn't have to be by a urologist, but I have a lot of men that see urologists, and if I have any questions about what's going on, I love to have the blessing from the specialist, and it certainly is very reassuring to have a urologist say that this patient is a definite candidate for hormone replacement therapy. So I always encourage men, you need a full urological workup. Now, we do the urological workups here in the office, but I do refer a lot of men, especially over the age of 50, to get clearance from urology before we start any type of hormone replacement therapy. And that's definitely reasonable and prudent to do. So once we have that clearance and we have the blood results back, I like to have the patient come back to the office and we'll discuss the lab results in detail. So when we're looking at the estradiol level in men, we know that men have a small amount of estrogen, and we don't want to block completely their production of estrogen. But if we do testosterone replacement, there is an enzyme in the body for both men and women called aromatase, which will do a bit of a natural conversion of testosterone into estradiol. So having that baseline on what a man's estradiol level is helps us with knowing what we need to do for hormone replacement. So an average range for men on their estradiol level would be in between the ranges of about 10 to 42. And I don't like my men to go above the range of about 30-35 when we're doing hormone replacement therapy. And also it gives us an indicator of what the body is doing if they haven't done any hormone replacement therapy and their estradiol is running a little bit high. We may need to look at other things before we do hormone replacement therapy. But if their levels are fairly within normal limits, then that tells me that they're not having any pathological issues that are causing increase in estradiol levels that we need to look at further. And it's also important with the lab results that people know that lab results are not the be-all end-all, and every lab is going to be a little bit different because the lab is not necessarily using the national standard for their normal values. A lot of times they're using the levels that are an average from the patients that they're testing. So that's why you may see different labs with different normal value ranges. So I always tell people to be aware of that. And then when we look at the testosterone level for men, total testosterone, depending on the lab that's being used, could be anywhere between 150 and usually around 900. So depending on which lab we're looking at. I really don't like to see the levels drop below 500 because we know that there are certain increased risks associated with levels that are below 500, specifically increased risk for heart disease, colon cancer, breast cancer, heart attack, stroke, development of Alzheimer's disease. Now, that doesn't say that testosterone is solely responsible for that, but we do see increased risks in individuals who have total testosterone levels below that. Now, some providers will get a free testosterone, a bioavailable testosterone, and that's always good to get as an initial workup. But I primarily am looking at the total testosterone initially to see where and how we need to proceed. So if I want to take a male who's got a low testosterone level, a lot of times their levels will look within normal range for the lab. Maybe they'll be 300, maybe they'll be 200, and that looks like it's within normal limits, but it is substantially less than 500, and I know that they would feel better if we got their levels up above 800. So that's a little bit what I strive for, to get them into a good range, to decrease their risks for some of these health concerns that we see as men get older. Once we look at the testosterone level and we go over that, we're going to look at a PSA, which is the prostate-specific antigen. And so that level we know always goes up as men increase in age. And actually there's been controversy for a couple of decades at least that I can remember where it's been argued, do we need to do a PSA, do we not need to do a PSA, how effective are they? Are they leading to over referrals to urology? From my personal and professional perspective, I do like to get a PSA on all of my men above the age of 45. And certainly it is a screening test, and there are different breakdowns that you can do if that is elevated. But I would rather do the test and have a good value and know that, I'm pretty sure everything is going to be fine with this patient, especially after doing a prostate check, than not doing a PSA and having an issue arise and hey, their PSA is now really high. So I routinely do them. I find that the insurances routinely pay for them, and I am one who I want to know what's going on the inside. I can't look in there and tell. So I want to know what is going on with the patient's levels. So I do draw them, and it is indicated prior to doing testosterone replacement therapy. So we know as men get older, their lab results are going to go higher for their PSA. So normal that is usually on the range of normal for most labs is 0 to 4. And so depending on the person's age, depending on their prostate level, their prostate exam, if everything looks normal, then I feel like that they are a good candidate for testosterone replacement therapy. Then we'll address that at that visit. I also look at the complete blood count. We talk about their hemoglobin because we know when we do testosterone replacement therapy, it can increase the hemoglobin level, and we want to make sure that we're not starting with a level that's too high, or that the patient's not anemic as well. That's why I check the full complete blood count. I want to know that their white blood cell count isn't too high or too low, that their red blood cells look good. What's the breakdown of the white blood cells? What are their platelets look like? I want the full picture. And then we look at the complete metabolic panel because I want to make sure, are they developing diabetes? Are their kidneys functioning appropriately? Is the liver functioning appropriately? What are the electrolytes doing? What are the protein levels? And so we discuss all that during the visit. And then the thyroid levels. We look at that as well because, again, a lot of these symptoms can be associated with low thyroid. And as our bodies age, every part of our body is aging, and that includes the thyroid gland. And so we don't want to miss anything going on with the thyroid that may need to be addressed at the same time. So if everything is looking like it needs to look and I talk to the patient, then we'll start to address and talk about what type of hormone replacement therapy would be best for them. I am not a huge proponent for synthetic hormones. I think that they can give people side effects. They can give people some complications. So I usually will recommend bioidentical testosterone replacement therapy. And most of my men they don't want synthetics. They want something that's more natural. And so I haven't really had anybody other than being concerned over price that doesn't want to do bioidentical hormone replacement therapy. And when I say price, I mean, a lot of the FDA approved testosterone replacement therapy is covered by insurance, and that can be an issue if somebody's trying to decide if they want to do injections or they want to do a gel or they want to do a patch. So for men, there are several types of testosterone replacement therapy. You can use a gel that is applied to the skin. You can use a patch that's also applied to the skin. You can use pellet implants, which is what we do mostly here at the clinic. You can use a nasal application. You can use a troche, which again is a dissolvable tablet that goes into the mouth and dissolves between the cheek and the gum. And you can use injection with testosterone with cypionate. That is probably my least favorite form because the cypionate can give a lot of side effects to men. It's the synthetic binder that's used in that testosterone. So once the person has decided what type of hormone replacement therapy they'd like to do, then we proceed with that type of therapy. Here at the clinic, I primarily, for men, use either the troches or most of the time the pellets. Occasionally, I will use a gel, just depending on what that patient would like, but I do like the bioidenticals. I think that they are much safer. So the way that the pellets are done is the patient is numbed up on the back side of the hip. A small incision is made. The trocar, which is basically kind of looks like a metal syringe, is placed into the subcutaneous tissue. The plunger is removed. A pellet would be placed in. the plunger put back and the pellet would be placed in. Now, usually for men, there's multiple pellets, so they can be placed in at the same time, but in a little bit different locations. So turning the trocar will place it in a slightly different location. Once that's done, the trocar is removed, the steri-strip is applied, and a bandage is applied, and then discharge instructions are given for decrease in activity level on that gluteal muscle for about 7 days, not getting into a tub for about 7 days, and they're given instructions on how long to leave the bandage on and on routine recovery and on watching for any complications or adverse events. And the patients are always given my home phone number so that they can text me, they can call me, and that's very important in any provider you see, that you have the ability to contact somebody if you're having a side effect or an adverse reaction or say signs and symptoms that are something you have questions on and you need to contact your provider. Because frankly, if you have to go to the emergency room or you're going to urgent care, they may not know how to treat you if you have just been given hormones, because that a lot of providers, that is not their forte. They are not significantly trained, or they don't have that specialty training where they can give you the information or treat you appropriately when they are not aware of the type or amount of testosterone that you've been given. So it's very important that whoever you go to, that you do have the ability to either contact them or somebody that's on call for them that also has that specialty training. Now, there are contraindications for men who do have low testosterone and would like testosterone replacement that we just really can't do it in. And that would be a history of prostate cancer, current prostate cancer, anybody who has a history of current or active cancer of any kind, if they have a prostate nodule, or if they have an increase in PSA above 4, or if they're high risk and have a PSA above the level of 3, which is why a urological evaluation can be really helpful and is definitely necessary prior to doing any type of testosterone replacement. Now, if you're doing synthetic testosterone replacement, then those contraindications still exist, but also you would not do any type of synthetics with uncontrolled heart failure, having a heart attack or a stroke within the past 6 months, any untreated obstructive sleep apnea, hematocrit above 48, and we check the hemoglobin and hematocrit. If men are planning to have any type of prostate surgery, or they have any issues with the prostate. Now, there is kind of a controversy on giving men testosterone if they're planning on trying to have a family. So with synthetic testosterones, we certainly don't want men to be on those when they're planning to have a family. We don't want that to be an issue. However, they are doing some research now on bioidentical testosterone and whether or not it is an issue with fertility. It doesn't appear to be, although I know that they're still doing a lot of therapy on that. So usually if somebody's planning to have children, we will hold the testosterone replacement. But we do know, and we have seen in current literature and current studies, that heart disease, stroke, are actually diminished with having a man's testosterone level balanced and having him in proper hormone balance. So when they say that uncontrolled or heart failure, we still don't give men testosterone in that regard. But if we're helping to diminish heart disease to begin with when men are young by balancing their hormones and make sure that their testosterone level is where it should be, we're helping to decrease that risk of it developing in the future. So after we pellet somebody or we start testosterone replacement therapy, a month after that therapy, we're going to get lab results again. So we're going to check the hemoglobin. I usually do a complete blood count because I want to look at the hematocrit as well. We're going to check liver function tests. We're going to check cholesterol. We're going to check the PSA again, and obviously the testosterone levels. And we're going to consider getting a DEXA scan. So we know that low testosterone predisposes people to osteoporosis. So having a baseline DEXA scan is also often helpful because we're finding that with testosterone replacement, we're seeing an increase in bone health. So if somebody is getting synthetic testosterone, then that can be a different issue as far as the DEXA scan results. So when we're doing those tests a month after, we definitely to get a morning testosterone level. And then a lot of times we'll check the hormone levels again at 3 to 6 months, depending on the type of therapy that they're getting, depending on their symptom relief and what their labs were initially, and then at the 1 month check. So oftentimes at 3 to 6 months, we'll check again the liver functions, the cholesterol panel, the PSA. We'll check the estradiol, and I always check that a month after as well, make sure that they're not converting too much testosterone to estradiol. And then make sure that the hematocrit and hemoglobin are normal. And then obviously yearly you're going to want to have your physical exam. Blood pressure needs to be monitored. I always do an EKG on patients just as a baseline and also to recheck, because as people are getting older, the heart is also getting older, to see what their levels are. And then, we also do a lot of counseling on exercise, proper diet, and on maintaining a healthy weight. So that's a lot of what we do with the hormone replacement therapy. Men in general are very excited to have their testosterone replaced, to have the vitality that they had when they were in their 20s and 30s, and it can be a real game changer. But men have to be careful as well. Hormone replacement therapy isn't for everybody, and some men don't want to do hormone replacement therapy, and that needs to be respected as well. Everybody should have a choice in their health care. I strongly believe that. I always believe that whatever a patient decides to do, they should be definitely aware of their treatment options, and they should be supported in their decisions, no matter what that decision is, and no matter how the provider happens to feel about the decision that they're making, because everybody has their own life that they're living. People need to be respected for the choices that they make. So whether they're doing testosterone replacement or they're not, they should still be respected. They should not be judged either way. So that is basically the lowdown on male testosterone replacement therapy. If you have any questions, concerns, issues, if you'd like to contact us for more information, or you have a comment that you would like to make, I would love to hear any of those. So please don't hesitate to reach out. You can ask questions on our podcast. You can also contact us on our website at www.evercarefamilypractice.com. You can email us at evercarefamilypractice@gmail.com. You can call our office at 505-780-8301. You can message us on Facebook. And I appreciate everybody taking time to listen today. I'd like to thank Brad F. as well as Virginia. I would like to thank Kathy V. I would like to thank Amanda. Everyone who's listening in New Mexico, Pennsylvania, California, India, across the United States and globally, for taking the time to get a little bit more information. And again, I welcome any and all comments, and I hope you have a great rest of your day, and that you're happy and healthy, and that you continue to live a life that allows you to make any and all decisions for yourself that you feel are best for you. Thank you again.